Now let's talk about limitations. There are certain conditions where teeth whitening is simply not going to be effective. One is tetracycline staining. Now, tetracycline staining usually happens when the pregnant mother consumes tetracycline antibiotics, and these present with a banding effect on the teeth, and whitening shows to be very limited in how much it can achieve. It may lighten the bands a little bit, but it's not going to completely eliminate them. Another place where whitening may not be too effective is fluorosis, when there is excess fluoride content at the time of development of the permanent teeth. We then tend to see these sort of discolorations on the teeth, which again, whitening may help to some extent, but it's not going to eliminate it completely. Next, if the tooth has been traumatized, like if the patient had a fall and that tooth is now brown in color, that's because of the blood vessels popping inside the tooth, to put it in very simple terms. And external whitening is not going to help those teeth. We need to do something called internal whitening, where the whitening agent is placed inside the tooth, typically after a root canal treatment has been completed. Another place where whitening is not going to be so effective is when there are pre-existing restorations. So that means fillings, veneers, crowns, any kind of ceramic, none of this stuff is going to get whitened. It only works on natural teeth. And lastly, any condition like dentinogenesis imperfecta or amelogenesis imperfecta, these are also going to have discolored teeth, and the effect of whitening is going to be very, very minimal in improving the condition of these teeth. So don't promote whitening as a one-stop solution for all your patients' cosmetic problems, because there are many cases where you're going to see really, really limited effectiveness. I hope I've confused you enough. Till the next time we meet, this is the Dental Review Guy signing off with a smile.